Hello, I'm Dr. Sophie Miller, and today I'm going to tell you about an apparently harmless habit that could be putting your life at risk every single night. If you're over 60 years old and you usually take a very hot shower before going to bed, thinking that this will help you relax and have a peaceful night, I need you to stop everything you're doing and pay close attention to what I'm about to reveal right now. This nighttime ritual that seems so comforting could be the silent trigger for a stroke while you sleep. And the worst part is that you won't even realize you're in danger until it's too late. Have you ever woken up in the middle of the night with unexplained dizziness, headaches, or that strange feeling of mental confusion? Have you felt that something wasn't right but ended up going back to sleep thinking it was just tiredness? Well, you should know that these could be the first signs that your brain is suffering from dangerous drops in blood pressure during the night, and the culprit might be in your shower. Does it sound exaggerated? I'm going to show you exactly what happens inside your body when you take that scalding shower before bed, and why this becomes exponentially more dangerous after the age of 60. When you step into a shower with very hot water, above 40 degrees Celsius, something immediate happens in your body. Your blood vessels begin to dilate rapidly in a process we call vasodilation. The body does this automatically to release heat and regulate internal temperature. It's a natural and apparently harmless response. But here's the problem that most people completely ignore. With the vessels dilated in this abrupt way, your blood pressure drops significantly and suddenly. Imagine that your blood vessels are like pipes that transport water. When these pipes widen suddenly, the water pressure decreases instantly. The same thing happens with your blood. Now comes the most critical part, and this is where the real danger sets in. When you get out of the shower, especially at night when your body is already naturally preparing for sleep, your organism tries to compensate for that pressure drop. It needs to return to balance, right? But it doesn't always manage to do this in time, especially if you already have unstable blood pressure, diabetes, or some cardiovascular history. And what happens when the body can't compensate for this drop? You enter what we call nocturnal hypertension, a condition where blood pressure drops too much during sleep and drastically reduces blood flow to the brain. It's precisely in this critical moment, usually between 2 and 6 in the morning, that most nocturnal strokes happen. You're sleeping deeply without having the slightest idea that your brain is being deprived of the oxygen it needs to function. Studies published by the American Heart Association are extremely clear about this. The abrupt variation in body temperature before sleeping is directly associated with an increase of up to 35% in the risk of cerebrovascular events in people over 60 years old. 35%. This is not a small thing. We're talking about more than a third more chance of suffering a stroke simply because of a hot shower at the wrong time. Can you imagine that something so simple and everyday could have this impact on your health? Let me tell you the real story of a patient I treated a few years ago. I'll call her Mrs. Maria to preserve her privacy. She was 67 years old at the time, a super active person. She walked every morning, took very good care of her diet, controlled her weight, but Mrs. Maria had a habit she considered sacred and untouchable. Every day, punctually at 10:30 at night, she took a very hot shower, almost scalding according to her own description. She said that moment was her ritual to relax and manage to sleep better, that without that shower, she couldn't disconnect her mind. One morning, around 4 o'clock, her husband woke up and immediately noticed that something was very wrong. Mrs. Maria had her mouth completely twisted to one side. Her left arm wasn't responding to movements. And when she tried to speak, the words came out jumbled and meaningless. He recognized the signs. They were classic symptoms of a stroke. They rushed her to the hospital, and fortunately they got quick attention. She was treated in time and managed to recover well, but unfortunately, she was left with some mild speech sequelae that remain to this day. When I began to investigate her history more deeply, a very clear pattern began to emerge. Mrs. Maria's blood pressure was slightly elevated during the day, nothing alarming, but it showed abrupt and worrying drops during the night. And what was the main trigger? Exactly that scalding shower before bed. She had no idea, but she was creating every night a real cardiovascular roller coaster in her own body. The worst part is that this could have been avoided with changes so simple you won't even believe it. So answer me something with complete honesty. Are you making the same mistakes that almost cost Mrs. Maria her life? Do you take a shower with very hot water between 9 and 11 at night? This combination of extreme heat with proximity to bedtime is absolutely the most dangerous that exists. The body is already naturally decreasing its functions to enter sleep mode, and you throw this bomb of vasodilation and pressure drop on top of it. It's like trying to brake a car that's already decelerating. You can completely lose control. Another extremely dangerous thing. Do you usually get in the shower right after a heavy meal at night? Think with me. Digestion is already demanding enormous blood flow to the stomach and intestine. The hot shower pulls even more blood to the surface of the skin because of vasodilation. The result? The brain and heart are literally left in second place, receiving less blood and oxygen than they should. It's like trying to feed 3 people with enough food for only 2. Someone is going to be left without what's necessary. And there's more. Do you usually get out of the hot shower and go directly to a cold environment, like with air conditioning on in the bedroom? This abrupt thermal change causes a real shock to the cardiovascular system. The body was all dilated and relaxed with the heat. Suddenly it needs to contract quickly to conserve heat in the cold. This dramatically elevates the risk of cardiac arrhythmias and dangerous drops in blood pressure. It's a lot of stress for a heart that's no longer 20 years old. If you already have naturally low blood pressure or take medications to control high blood pressure, the scenario becomes even more concerning. These medications already work by reducing your blood pressure, right? The hot shower tremendously potentiates that effect. It's like taking a double or triple dose of the medicine all at once. The pressure drop can be so severe that you can faint, fall in the shower, and hurt yourself seriously, in addition to all the cerebrovascular risk I already mentioned. Now pay attention to these signals that your body is desperately trying to give you. Do you feel dizzy when you get out of the shower? Does your vision become blurred, or do you see those little black spots? Do you feel weakness in your legs or a sensation that you're going to faint? These are urgent warnings that your blood pressure has dropped too much, far beyond what would be safe. Don't ignore these signals. They are your body literally screaming that something is wrong and needs to be corrected immediately. But calm down. You don't need to panic and think you'll never be able to shower again. I'm going to teach you now exactly what you need to do to transform this potentially fatal habit into something completely safe and even beneficial for your health. The first change is simple but makes all the difference in the world. Adjust the water temperature to warm, something between 35 and 38 degrees Celsius. It's still a pleasant and relaxing temperature. You'll continue feeling that shower comfort, but it won't cause excessive and dangerous vasodilation. Your body will thank you immensely. The second change is about timing. If you really like to shower at night, do it at least 2 hours before going to bed. This gives enough time for the body to completely stabilize body temperature and normalize blood pressure before you enter deep sleep. Your organism needs this recovery time. You can't skip this step. Can you imagine the results with this simple change? You're going to sleep much better and safer. If you're one of those people who really loves a very hot shower and can't give that up, no problem at all. But do it during the day, in the morning or early afternoon, never at night. During the day, your body has much more compensation capacity. All your systems are active and functioning at maximum. The heart is stronger, pressure is more stable, and any fluctuation is quickly corrected without causing problems. Here's a golden tip that can literally save your life. After the shower, sit down for 2 or 3 minutes before getting up and leaving. It can be on a small bench, on the toilet, anywhere that's safe. This avoids that sudden dizziness and pressure drop that happens when you change position too quickly. This is a technique we use a lot in hospital settings, and it works perfectly. Do you already do this, or do you always get up quickly? Another very important thing: monitor your blood pressure before and after showering for at least 1 week. Write down the values in a notebook or on your phone. If you notice drops greater than 20 millimeters of mercury, this clearly indicates that your body is reacting badly to heat, and you need to talk to your doctor about this. This data is pure gold for any healthcare professional to make an accurate assessment of your condition. Going back to Mrs. Maria's story, because it has an inspiring ending that needs to be shared. After that enormous scare of the stroke, she decided to completely transform her routine. She started showering at 7 in the evening, always with warm and pleasant water. She placed a firm and safe stool inside the shower to be able to sit after bathing, and she began to religiously monitor her blood pressure, creating a true diary of her cardiovascular health. 3 months later, when she came back for a follow-up appointment, she told me something I'll never forget. "Doctor, Sophie, I sleep much better now. I wake up more energized and I don't have those horrible dizziness spells in the early morning anymore." It even seems silly to say this, but it was the shower that was making me sick all this time. Who would have thought? And I answered her what I'm going to repeat now for you. It's not silly at all. It's science applied to real life. It's preventive medicine working exactly as it should. But why does all this become exponentially more important and dangerous after the age of 60? Let me explain what happens with the natural aging of the body. Baroreceptors, which are specialized sensors that automatically regulate your blood pressure, naturally become less sensitive over the year. It's as if they lose part of the ability to respond quickly to changes. The heart also loses some of that quick response capacity it had when you were younger. And there's more. Many people in this age range have already developed fat plaques in the arteries, which makes efficient blood circulation even more difficult. That's why a habit that at 30 or 40 years old didn't cause any problem, had no side effect at all, at 60 years old can be literally fatal. The body is no longer the same, and habits need to adapt to this new reality. This is not weakness. It's wisdom. It's understanding that taking care of health means making intelligent adjustments as life progresses. Nocturnal stroke is treacherous because it's completely silent, you're sleeping deeply, and there's no way to perceive the signs. But the good news, the news that really matters, is that it's totally preventable. Based on decades of studies in the area of vascular neurology and years of direct clinical observation with real patients, the message couldn't be clearer. After the age of 60, the hot shower at night is not an innocent relaxant. It's a real and measurable risk that you simply don't need to take. The difference between a completely safe shower and a potentially dangerous shower can be just 3 things: the water temperature you choose, the time when you take that shower, and the way you get up afterwards. They're three apparently small details, but they can literally save your life. Three simple choices you make every day and that have a gigantic impact on your cerebrovascular health. So tell me here in the comments, do you or someone in your family have this habit of hot showers at night? Had you thought about these risks before? Are you going to make these changes starting today? Share this video with that person you love who needs to know this information urgently. It could be your mother, your father, your grandparents, that dear uncle. This could be the information that will protect someone very special to you. And if you're not yet subscribed to the channel, subscribe now and activate the notification bell, because I'm going to continue bringing science-based information that really makes a difference in your practical life. Take care of yourself with intelligence and love. Your brain deserves to reach 70, 80, 90 years functioning with total clarity and vitality. And this starts with conscious and informed choices, even at shower time. Stay with me because in the next videos I'm going to show you other nighttime habits that, without you realizing it, are stealing precious years from your brain health and your quality of life. A warm hug, and see you in the next video.